Hello, everyone, and welcome to Not Just Numbers, Honest Conversations with a Financial Advisor and Lawyer. I am Madison Demora, and I am here with Mike Gary. Mike is a financial advisor and a CFP, and the founder and the CEO of Yardley Wealth Management. He is also an estate planning lawyer, and his law firm is Yardley Estate Planning. Hey, Mike.
Yeah. Hey, Maddie, how are you?
Good, good. So, everyone, welcome to our series 4 out of 5. Today, we are going to discuss understanding Medicare basics. So, Mike, my first question for you, what are the different types of Medicare coverage available to beneficiaries?
Sure. Medicare offers four main types of coverage. Part A, which is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage plans. And Part D is prescription drug coverages.
Okay. So, what are Medicare Advantage plans and how do they differ from original Medicare, Part A and Part B?
Sure. Medicare Advantage plans, also known as Part C, are private health insurance plans that offer coverage for both medical and hospital services. They often include additional benefits like prescription drug coverage and may have different cost structures and networks compared to original Medicare.
Okay. So who is eligible for Medicare and what is the enrollment process for Medicare?
Sure. So most U.S. citizens or legal residents age 65 and older are eligible for Medicare. The enrollment process typically involves signing up during your initial enrollment period, which is around your 65th birthday, and some may also be eligible due to disability or certain medical conditions earlier.
Okay. So how can individuals supplement their Medicare coverage to fill in the gaps of Part A and Part B?
Sure. So individuals can supplement Medicare by purchasing a Medicare supplement called Medigap policy, which helps cover out-of-pocket costs like co-payments and deductibles. Another option is to enroll in a Medicare Part D prescription drug plan to cover prescription costs.
Okay. So what specific types of healthcare services does Medicare Part A cover compared to Medicare Part B?
Sure. Medicare Part A primarily covers inpatient hospital care, skilled nursing facility care, hospice care, and home health care services. Medicare Part B covers medical services such as doctor visits, outpatient care, preventive services, and durable medical equipment.
Okay, so can you explain how Medicare Advantage plans operate and highlight their advantages over original Medicare?
Sure. So Medicare Advantage plans are offered by private insurers and combine Part A and Part B coverage. They often include extra benefits like prescription drug coverage and may have lower out-of-pocket costs. They also typically have a network of healthcare providers.
Okay. So, what is the initial enrollment period, IEP, for Medicare, and why should eligible individuals pay attention to it?
Sure. The IEP is the initial window during which individuals can enroll in Medicare without penalty. It's important because missing this period may result in higher premiums for Part B and Part D if you enroll later. And those higher premiums are like for the rest of your life. So enroll in Medicare by 65, unless you're covered by an employer plan and a specific type of employer plan. So you need to look into it. And then if you are in an employer plan that's eligible that you don't have to yet sign up for Medicare, you can do that. But then make sure once you're planning to retire that you start the sign up process, the enrollment process for Medicare. It's really important.
Okay. So, what are Medigap policies and how do they complement original Medicare coverage?
Sure, they're private insurance plans and they're designed to fill gaps, right? Medigap in original Medicare. They help cover expenses like deductibles, copays, and other out-of-pocket costs. You must have original Medicare, Part A and Part B, to purchase a Medigap policy.
Okay. How can individuals decide if they need supplement coverage beyond original Medicare, and what factors should they take into account when selecting such coverage?
Sure. You need to consider your healthcare needs, budget, and preferences. If you want to minimize out-of-pocket costs, protect against unexpected medical expenses, or have specific healthcare needs, supplemental coverage like Medigap or a Part D may be a good choice. Consulting with a Medicare specialist or counselor can also help with the decision. it's a big thing, and people tell us how complicated it is. It would be a good idea to get some help with it, I think.
Yep. All right, everyone. Thank you for listening to our fourth series out of 5. Join us for our next episode where we will be talking about managing the transition to retirement. For more information on Yardley Wealth Management or Yardley Estate Planning, you could visit our websites at yardleywealth.net and yardleyestate.net. You can also follow us on socials at Yardley Wealth Management. This podcast has been produced by Madison Demora and Mike Gary with technical and artistic help from Poe Productions.